Good afternoon, and thank you everyone for tuning in today to our media update. I hope everyone continued to follow public health recommendations over the weekend and enjoy this incredible weather outdoors, and it seems like it's going to be with us for a while. I would like to remind everyone that this Thursday, November the 12th, is our next COVID-19 town hall. This town hall's theme is Coping During COVID, where we focus on mental health issues. So tune in at 7 p.m. and join myself, Dr. Richardson, Paul Johnson, and our two special guests, Dr. Randy McCabe, psychologist in chief and director of the Anxiety Treatment and Research Clinic at St. Joseph's Healthcare, and Dr. Paula Pears, clinical director of the Child and Youth Mental Health Program, Hamilton Health Sciences. I look forward to hearing from all of you with your questions, and I know that we've got some good people to provide some great answers, especially in the mental health field. So again, thank you to Cable 14 and CHML for carrying these two town halls, and we'll look forward to you dialing in on Thursday at 7 p.m. Remembrance Day is upon us. As you all know, this Wednesday, November the 11th, is Remembrance Day, a day to remember, honor, and thank every Canadian who sacrificed their future for us, who served their country. But due to COVID-19 gathering restrictions and in accordance with the directions from our Emergency Operations Center, there will be no public services conducted for Remembrance Day, including military parades or large public gatherings at City Cenotaph. So there will be no cenotaph activities or ceremonies this year. The Lancaster, however, will conduct a flyover over the Hamilton Cenotaphs in acknowledgement of the day. And of course, you can watch the virtual service from 10:30 to 11:15 online at Cable 14 or the city's YouTube channel, www.youtube.com/inside the city of Hamilton. You can catch all the virtual services there. And of course, leading up to Remembrance Day, I encourage you all, everyone, to wear and purchase red poppies in honor of those who gave their lives in service to our country. And as well, on the 11th day, in the 11th month, at 11 a.m., we're going to ask everyone to observe 2 minutes of silence to recognize the fallen and those that sacrificed their lives for us all. I will now pass it on to our Emergency Operations Center Director, Paul Johnson. Paul?
Thanks very much, Mr. Mayor. Today I wanted to start off with a little commentary about the rising number of cases and just how it impacts a number of things that we're watching from an Emergency Operations Center perspective. I know Dr. Richardson will take us through the numbers and take us through some of the public health dynamics, but I just want people to know that one of the things that is really worrying us at the Emergency Operations Center when we look at our community partners who are providing service in congregate settings, when we look at our own services here at the City of Hamilton, is the number of people that are having to isolate who may be COVID-19 positive themselves. And when you think about these cases and think about why we say we want to get these numbers down, please help us all make sure that these cases stay at a low number. Think about the impact it has on employees who have to isolate, who can't go to work, and our ability to deliver services at the City of Hamilton, but also for our partners in the community to deliver critical services. I don't talk to a single provider of services in the community, and whether that's mental health and addiction services, our emergency shelters, our retirement homes and congregate settings, and our long-term care settings, who aren't worried about their human resource element. And they're worried, obviously they don't want anyone to get sick because we never know the trajectory of the illness if people get sick, but also they don't want them to have to be out of the workplace, because how do we replace these folks? You know, one or two, maybe. But when you get larger numbers of people that have to isolate or are away, it becomes a real challenge to deliver critical services. So, again, these messages that we put out really take it to heart that the impact of having rising cases in a community is not just about the individual illness. That's certainly a consideration. It's not just about the protection of vulnerable people who are in critical areas, but it is about those who work every day to keep critical services going. And I can't stress enough how much we worry that if we run into human resource issues and the inability to deliver services, how that has another health impact on people that we're trying to serve. And so I want to, say today that it is critically important that we follow the rules and that we do everything in our power to stop the spread of this virus. From an enforcement perspective, the education of these newer rules has been long over. weekend or so ago, I heard of a bar packed to the gills, serving alcohol well beyond the appointed time that the province had laid down. We laid charges, of course, and did what we needed to do. This past weekend, you know, people getting up and singing and playing music and dancing and having the crowd dance, no masks, no physical distancing in an establishment. And again, obviously enforcement happens, but I have to scratch my head. Little infractions here and there may occur, and I understand human error, but to not have any contact tracing information being collected at an establishment, to not have masks being worn, to have people singing and dancing and carrying on as though nothing is going on in our community is entirely disappointing. It's disappointing for the people who run those establishments. It's also disappointing for the people who are there. You can't tell me that that group of people all have no idea what's going on with coronavirus. 8 months into us, our emergency operation, and of course, now heading into 11 months since we've been talking about this in our community. So yes, we're out there enforcing, but we can't be everywhere. Yes, we're monitoring everything that's going on, but we can't manufacture employees to go and do critical jobs. That's our job together, to ensure that we have as few people as possible, doing the types of things that cause the opportunity for this virus to spread. So wanted to start with that message today and pass it over to Dr. Richardson, who I know has some more information on our rising cases here in Hamilton.
Thanks very much, Paul. And as you indicated, it is a very sobering day. We're at 2184 cases in total, which is 67 new cases from yesterday. Last week we were reporting at 20 new cases per day, and now we're at 43 cases per day and rising. Yes, we've got 1,700 of those that are resolved, but there's 364 active cases in Hamilton, which is the highest number that we have ever had. To date, we've had 54 deaths, with 2 new deaths over the weekend and 1 today. A female in their early 90s from Chartwell Willowgrove passed on November 4th. A female in their early 90s from the village of Wentworth Heights passed on November 6th. And a male in their early 100s from Hamilton Continuing Care who passed on the 7th of November. And our thoughts go out to each of those families, to those institutions who have been supporting those people, because they have paid, of course, the price of COVID-19. We do currently have a total of 19 outbreaks on our website, with 1 new one added today, and that's at Macassa Lodge. And of course, you can find out on the website all of the details around those outbreaks, as you usually can. But these very high case numbers that we are seeing over the past several days are extremely concerning to me, and they should be very concerning for each and every one of us in our community. As you've heard me say before, nothing has changed about the virus. What has changed is what we are doing collectively to protect ourselves and others from the virus. You've heard from Paul some of the things that have been going on, which, as he said, we know what we need to do, and those are definitely the things we need to not do in order to control the spread of COVID-19. Given the behaviors we're seeing and the things that we hear about during the case management and contact tracing that we do, the numbers are going to continue to get higher and higher unless we change something. This virus does not discriminate based on age, based on gender, based on the neighborhood that you live in. It can spread to everyone at any time. Nobody is immune to this. Everybody is susceptible, and the numbers are showing just that. There are several risk factors that drive transmission of COVID-19 in our community, and close contact continues to be the highest risk. So limiting those risks is critical to reduce transmission. It's critical to keeping the vulnerable safe, and it's critical to keeping businesses open and people able to work because the business can stay open, or for the business to be able to stay open because the people are there, as Paul has just said, to provide the services, to do the things that we need here in our community. Personal and public health measures such as physical distancing, staying home when you're ill with even mild symptoms, frequent hand washing and surface cleaning make a significant difference and are proven to limit COVID-19 transmission. And just as Paul has talked about some of the things that we hear and that our enforcement colleagues have to respond to, we do hear when we're doing case and contact management about people going out when they are mildly ill, that they don't stay home from social activities or stay home from work when they're ill. And those things need to change. It's critical that we understand the risk of gatherings and close contact in enclosed and indoor spaces in particular, and that we make informed choices. So it's vital that people only spend time with their household in close contact. If they're around others from outside their household, they need to be wearing masks. They need to be physically distancing, ideally outdoors, or if you're unable to stay physically distant there as well, to make sure those masks are in place. It's essential that we stay home and stay isolated from others in our household as well if we have any symptoms whatsoever. As you know, this past Saturday, the provincial government put into effect the new COVID response framework, and we sit in the protect or yellow category. However, if we continue to see the types of numbers that we've seen over the past few days, we will have to move into the orange category, or perhaps, given the significant rises we've had, we may even go beyond that, meaning that further restrictions need to be put in place. I know that nobody wants further restrictions. What we want to do is to be able to do some of the things we have been doing. We want business to stay open. We want to keep our economy going. And so for the health and safety of everybody in our community, it's important that we continue to follow good public health measures. Back to you, Mr. Mayor.
Thank you, Doctor. And yes, those numbers are very concerning, and we certainly ask everyone to double down on those very important issues. We are still in a state of emergency. I think people tend to forget that that hasn't gone away. We haven't removed that. It is an emergent issue, an emergency issue, as long as this virus is in our community. And so we need people to put their efforts into maintaining their household gathering. Some people have this illusion that there's a bubble of 10 very much in place, and that is not the case anymore. The cases are rising to the point where we need to abandon that. If you're going to be gathering with people, you should be masking, you should be outdoors, you should be staying 6 feet apart, and as much as humanly possible, staying only within your own household. And so visitations and all the things that we'd all love to do, and when we say we're all in this together, all of us want to be closer to our family. All of us want to be closer to our friends. All of us want to have social events where we can dance and let go and just enjoy the moment and the time. But this is not the time to be doing that. There will be a time for that, and hopefully we'll have a great celebration when this virus is behind us. But the virus isn't behind us. It's still very much here, and we need to keep doing what we need to do to prevent the spread of this virus, or we're going to have more significant restrictions laid down on us by the province of Ontario based on their new recommendations. So please, folks, do everything you can to avoid the spread of this virus. Continue to mask, continue to wash your hands, continue to physically separate as much as you can, and let's do our best so that we can keep things going and functioning the way we'd all like to, but with restrictions until such time as a vaccine is available. I'm going to turn it back over to Jasmine now for some media questions, and we'll see what kind of questions the media would have for us today. Jasmine.
Thank you, Mr. Mayor. We'll start with one question and one follow-up for everyone. First question to Bobby from CBC Hamilton. So Bobby, you can go ahead.
Thank you very much. I hope everyone's having a good start to the week. My first question is for Dr. Richardson and I guess maybe Mr. Johnson. That question is, are there any specific indicators within the color-coded framework that might bring us into orange or even beyond that? And as I understand it, public health can implement more restrictions beyond what's already present. So is there any consideration about adding more measures to try to prevent this continued spread?
Hi, Bobby. Thanks for that. When it comes to the indicators that you've seen that are in the provincial framework, there's the number of cases, the number of outbreaks, various things that are there, the public health capacity and the hospital capacity. So it is primarily the case numbers that are driving us right now in terms of the number of cases that we're seeing. And so those are very concerning. When it comes to outbreaks, those don't change a lot over the various levels. And we are seeing a number of outbreaks. So those are certainly pushing us, but they're not one of the key indicators for change. Some of the other ones are things like the public health capacity. And so we very much sit at our full capacity when it comes to responding to cases and contact management. We have significant numbers, as you've heard me describe many, many times, of staff who are responding to these. And we are actually asking the province for more and are in conversations with them about how they can help us out and send additional staff our way. And then we look at hospital capacity. And so we're fortunate right now that our hospital capacity, both in the acute care beds as well as the ICU beds, are doing okay. They are certainly seeing more patients than they had done. And that's unfortunately what we tend to see in these patterns, is you first start to see the cases in the community, then you start to see the cases in these congregate settings. And then what you start to see is that the number of people who are more severely ill, the number of people who are in ICU starts to climb. And so that's absolutely part of what we're trying to protect against, is people getting severely ill, ending up in ICU, and ultimately overwhelming our health system resources. So those are some of the key ones that we're looking at.
Great, thank you. And just as my follow-up there, is public health considering adding any measures on top of what's already in place to try to prevent this community spread? Because it seems like people aren't listening.
Thanks, Bobby, and for reminding me of that second part of the question. Yes, we're always looking at our cases and what we see going on in terms of what more we need to do. So, for example, with the outbreaks we're seeing in a congregate setting, we're back to doing proactive weekly visits, as we've done all the way through, but looking at doing visits as soon as they have a case in the setting. We go in, we do that kind of action. We're doing that along with our hospital partners. We're working on additional communication, education sessions, all those sorts of things. We know that the province is working with our colleagues in MLE and police, as you heard Paul talk about the enforcement actions that are underway to support this. And we'll continue to look at whether there's specific things that we could do that might actually help in terms of people getting the virus levels down. At this point, we don't have anything over and above the provincial framework, but if we see that there is, we will move forward with that. We'll talk with the province about where we sit in the framework and look if there's anything else specifically needed locally.
Thank you very much.
Thanks, Dr. Richardson. Next question will be for Matt Ingram from CHCH. Matt is having some audio problems though, so I will ask his questions for him. His first question: the City of Toronto announced a vaccine task force combining staff from key departments to get ready to deliver the vaccine to residents. Do we have any similar plans here in Hamilton?
So when it comes to the vaccine, we have a local Hamilton COVID response table that is meeting, and one of our groups looks at health promotion and immunization, and they have been working together on the flu vaccine strategy right now in terms of how we can get out there with the flu vaccine, and as well they are planning the COVID-19 distribution strategy. So we're working across all of the health system partners on that very issue.
Thanks, Dr. Richardson. Next question from Matt. Does public health feel comfortable with SPNCO's reopening plan?
So on that one, Jazz, I'm going to have to get back to Matt in terms of that piece. I know that my colleagues have been reviewing it, but I don't have anything specific on that today.
Okay, thank you. Next questions will go to Maria from the Hamilton Spectator. So Maria, you can go ahead.
Hi, thanks for taking my question. I wanted to ask about specific additional measures that are being taken in long-term care homes that are facing outbreaks. So can you speak to specifically what organizations have been sent in and what's being done regarding staffing?
Sorry, it's really hard to hear, Maria.
Oh, sorry, poor internet connection. I was asking about long-term care homes that are facing outbreaks. If you could speak to specific measures that are being taken with respect to staffing and what organizations may have been sent in to address the issues there.
Sure, absolutely. Staffing in these facilities is one of the challenges as they go forward when there are outbreaks. Not only do the staff who have been infected, who are positive for COVID-19, end up out of work, but also the contacts can end up out of the workplace as well. And so while they're serving their isolation. So there is a congregate settings table as well of that Hamilton COVID response table who look at the issues and look at what staffing supports are needed. So at least 2 of our homes do have LIN staff who are in supporting them. The hospitals also are prepared to go in and support long-term care if they need to. And they're just discussing as well what further supports on the IPAC sides would be helpful. So our hospital colleagues as well as public health colleagues do a lot of IPAC training supports for staff. So their staff go in and assist them, and they're looking at what more is needed. But Paul may have more to add on this front.
So the one additional piece is that the province is very concerned about this as well, and so they're announcing plans to look at ways that teams could be available should it be necessary to send in some additional staffing supports if staffing gets to critical levels. And thankfully in Hamilton we've we haven't from a long-term care perspective had those issues happen, but if you look close by to us, a management order issued in Niagara for stabilization efforts around long-term care. So I think what everybody is concerned about is what do you do when your staffing levels get to critically low, and how can we all help out? And the reality is, with hospitals starting back up service and everyone else in the community starting back up service, there aren't as many people around who aren't doing their normal job. Everybody's trying to get back to business as usual, critically important. So today's announcement of some additional support for those that get critically low in staffing are there, but still the best measures are if we can contain the community spread, because it's when we talk about long-term care facilities or retirement homes or some of these congregate settings, when their staff are out, it really is that if they've tested positive, that it's happened somewhere else. It's not within the home, and that's a challenge. So the more we can keep it down, the more we'll be assured that we have good staffing levels within long-term care.
Thank you. And my follow-up question is related to that control aspect. So have you been able to pinpoint how the virus is spreading in any of these homes? And if so, are there changes needed to restrictions or guidelines for the senior homes?
Hi, Maria. When it comes to the transmission in these homes, it's hard to pin down exactly what it is that is happening because there's a lot of different interaction that happens. Certainly what we look for is to make sure that the staff are screened coming in, to make sure that they're not ill, and make sure that it's a full screening each and every time. We're making sure that the universal precautions are in place where there are facilities that are not in outbreak, that they are in place, that if somebody is ill, that they're staying home as soon as possible, that once you do have cases, that you have this widespread use of PPE and that it's well followed. And you have to look everywhere when it comes to COVID-19 and think about it everywhere. So you have to think about it as staff. You have to think about what you're doing outside of the facility in terms of how you keep your risk low. About carpooling, you need to think about what happens in the break rooms. You need to think about how you not only that you put your PPE on, but how you take it back off and dispose of it. So there's many different places where you'd have to be aware. And so we review and make sure that people are thinking about all of those, but it's hard to pinpoint any of those specifics about where things might actually be happening.
Thank you.
Thanks, Dr. Richardson. Next question to Katrina from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My first question is for Paul. With the establishment that you were referring to that flouted the rules over the weekend, what is the name of the establishment? And did they have like an excuse for why what was going on there was going on there?
We don't name the establishments. I don't have the name, to be honest. So I'm not just holding back. I didn't receive it, and I don't think we named the establishments. And oftentimes the excuses range from we didn't know, and in this case, I think it was. I can't see, so I'm speculating here, but I can't see any other reason is that they just wanted to get people in and keep their business going. And while I understand the pressure business is under, and I've talked to business folks in our BIAs and everything else, some of these, the way it was flaunted in this case is just beyond the pale. This isn't a bending of rules, and this isn't I didn't realize all the things I needed to do. This was just sort of, let's open up and let whatever happens happen. So these are the kinds of things. They are not occurring all the time. Given the number of businesses we have in Hamilton, I do know that we should be speaking in a positive tone about most of the businesses and establishments are doing a great job around this. But to find these things happening where it isn't, as I say, that they just didn't take enough information for contact tracing, for instance, they didn't have the right, phone numbers or this or that. Those are things we can teach and correct and reinforce. But to be having all of this happening, really does, you question the motivations that are there. And I understand for one night, you're not going to see great, things happen. It's what happens in the following days and weeks. And we only need to look at, and I'll use Spinco because we did name them. You only need to look at the reach of Spinco to understand what can happen from one night of deciding that you're going to let the rules not apply. And that's whether we do that personally, backyard barbecues, basement events, big family gatherings, or whether it happens in a business setting as well. So, this is not an exercise to name and shame. If there's a public health reason that we would need to name things, that would come out of public health. So we don't generally do that, but I can tell you that it's disappointing. And I think that's what I wanted to leave with folks, is that I'm giving you a real example, and it is a pretty disappointing example, not of businesses trying hard, but simply, missing one of the many, many things they needed to do. But clearly, a few businesses along the way just don't care. And the impact that has on the contacts and the people that those people are close to can be enormous. And we've seen that happen in other communities. We don't want it to happen here in Hamilton. So that's why I use that as an example today.
All right, thank you. And then my next question is probably for Dr. Richardson. I think, there have been so many changes throughout the pandemic with rules and whatnot, and bubbles and circles, and who you can gather with and who you can't. Who are people allowed to gather closely with right now? And I'm also wondering, some, regions have put in restrictions. When you go to a restaurant, you're only meant to eat with people from your immediate household, or at least recommendations. And Peel has done that. How does that work in Hamilton right now?
Thanks. It's so true that there have been changes as we go along, and no doubt that at times that can seem challenging and need to stay up to date with the latest recommendations. But as things evolve and we understand the situation, just as with anything, advice changes, and so people need to keep up to date. So the current recommendations for us here in Hamilton are to stick with your immediate household as your close contacts, and not to have close contact with anybody who's outside of that household. So you can have a situation where you have somebody who lives on their own, and so they could join one household so that they can have that kind of companionship and close relationship with at least somebody. That's so important from a mental health perspective. But otherwise, if you're gathering with anybody who's not from your household, you should be maintaining physical distance, using masks, doing all of those things if you are not doing that. So when it comes to going out and dining, the specific restrictions are in place according to the provincial framework. But again, we would recommend, if you're going out to dine, you either go out just with your household, or you're making sure that physical distancing is in place. And so we know that can be pretty tough. So that may be challenging both for the operators and others, but that is the best advice to do. Right now, the specific restrictions are a little bit more liberal than that, but if we want to limit spread, we've really got to take the responsibility into our own hands as to what we need to do.
Thanks, Dr. Richardson. Next question is to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. I think my first question is for Dr. Richardson. So I'm just wondering about the yellow stage. So what difference will yellow make for Hamilton? And do you think it'll be enough to drive these numbers down based on the spread that we're seeing in the city?
Sorry about that, Fallon. I muted myself instead of unmuting myself. So Yellow really doesn't change much for us from where we were before. We had most of these measures in place already. There were some minor changes in terms of things like gyms, where now we've got the provincial framework around gyms, and so we're following those rules as opposed to the recommendations that we had out in advance of that. As to whether or not it's enough to reduce the spread, that's up to all of us. Really, we all have it in our hands. It's all in our power to reduce that spread by following the recommendations that are out there, being very thoughtful about what we do and whether we need to do it. And if we do that, we can bring the numbers down. It's happened before, but if we don't, we'll have to accelerate the control measures and go further. But that's certainly not where any of us want to go.
And yeah, you sort of touched on my second question. So today, Dr. Williams talked about increasing COVID fatigue. So, people sort of obviously getting fatigued by the pandemic and how that is helping to drive up numbers. What is the City of Hamilton planning to do to combat that here on a local level? Is there anything planned for that?
So you'll know that there's actually, province-wide campaigns that are planned as part of the implementation of this framework. And so we like to complement those campaigns. You hear us speaking about it today, the mayor, Paul, myself, we're going to continue to speak about it and what needs to be done. You'll see us continue to do social media in terms of what's needed, the town halls to talk to the issues. We'll continue to speak to those issues and recommend that people do them. We'll be following up. You've heard about some of the enforcement that's gone on this weekend. We know our colleagues in MLE are working hard in that regard. You'll see us continue to follow up in the areas where we have powers and an opportunity, whether it's in places that need to continue to have good infection prevention and control. But by and large, that's not where we're seeing the issues. The issues are more about what we're all doing out and about in our day-to-day lives.
Thanks, Dr. Richardson. Next question to Joanna, also from the Hamilton Spectator. Joanna, you can go ahead.
Thanks so much. My questions are for Dr. Richardson. My first one is, there is significant criticism of this, the province's color-coded framework, particularly that the thresholds are too high to move between the levels and that there are too few restrictions. What do you think of this framework, Dr. Richardson?
So one of the things that's really important about the framework is we now have transparency in terms of the numbers, the thresholds. We have clarity around what the baseline expectations are at each level around what's going to happen. And that's been really important for the public so that they understand what is going on, so that they can understand what level they're in, what choices they need to make in order to reduce the spread. It's been really important for business so that they can have more predictability, understand what's coming if the control isn't there. I think there is some concern about, is it going to be enough in terms of the control measures that are in place in order to reduce spread? I keep coming back, though, ultimately it does depend on all of us. The province wants us to, take back over and be in control around the spread of COVID-19 and are asking us to do our very best to do that. And so that's up to each and every one of us to do.
Thanks so much. And my next question is also for you, Dr. Richardson. Do you know what is driving this surge of cases in Hamilton? And considering that yellow doesn't really change much for us, what will it take for you to look at adding restrictions here beyond what the province has put in?
Thanks, Joanna. Yeah, as I said in my opening remarks, what we're seeing is it is about people who are not following public health measures. They're not physically distancing. They're going out to socialize or to work even when they have mild symptoms rather than staying home and waiting to see what happens. They're not wearing their masks. So it is the things that we are each doing that is driving those numbers. And so when it comes to enforcement, it does become, we have to take those broader blunt measures that result in businesses having to have more restrictions on hours, on what they can do, what they can't do, in order to drive that message home and to reduce the opportunities for transmission. And we'll keep looking, as I said earlier, we may end up going up through this framework, but we'll continue to look at what are the specific issues that may be driving transmission in Hamilton, and if we need to, taking additional action.
Thanks, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I'll pass things back to you for some closing remarks.
Okay, thank you to the media. Thank you to Dr. Richardson and Paul Johnson for your ongoing good work. And as we continue to find ways of communicating with the public at large in terms of the things that we need to do, we will keep doing that. And so, now more than ever, we need to communicate, remind people why it's important, why the spread of this virus is so dangerous, why we don't want to get into situations where we're overtopping our healthcare system, especially in light of flu season coming upon us, which again is a reminder to get your flu shot. And I know that there's some challenges out there in getting it, but I know there was a clinic here today at City Hall, and I know that the flu shots are arriving at the local pharmacies as well and doctors' offices. So do take advantage of getting your flu shot. It will be helpful in terms of avoiding hospitalization and keeping our healthcare system whole. Thank you to everyone for continuing to do your work. I want to thank Bill Custers, Cable 14, and Clear Cable for helping us put these broadcasts together. And again, reminder that keep following the public health recommendations. It's now more important than ever to do what you're being asked to do, which is physically separate distance as much as you can, continue to mask and wash your hands frequently, and those touch surfaces, all of that remains very, very critically important. So please adhere to that. And we will see you on Thursday for the briefing on Cable 14 at 7 p.m., where the focus will be on mental health, which I think will be very helpful information at that point as well. So beyond that, we'll see you at the next media briefing, Monday, November the 16th at 4 p.m. next Monday. Thank you. Talk to you soon.
Do you have feedback on Cable 14's programs? Let us know by calling 905-523-1414, extension 227, or email feedback@cable14.com.
Are you free on Monday nights and looking for the hottest game in town? It's right here on Cable 14, Kiwanis TV Bingo, giving away a $5,000